In the last couple of days, the ICRC teams working for the Mosul subdelegation have targeted more than 26,000 households in two main neighborhoods in West Mosul, distributing to them food, essential household items, and hygiene kits that would serve families of a size of 6 members for a period of 1 month. These neighborhoods are known to have been already in dire economic situation even before the conflict and before the military operation started to retake Mosul as a town. So the people living in these neighborhoods are mainly people working in labors and are farmers, are carpenters, etc. And they don't have any capacity to restore their economic security and livelihood for the moment. They are in quite desperate situation, and local markets and infrastructures doesn't allow them to have a more sustainable income. They don't have any resources anyways to be able to purchase the already limited goods available on the market. That's why we decided to come to their aid with some relief assistance. So families have no stock of food whatsoever. They don't have not even half a kilo of rice to rely upon. When we started doing the assessments and before we went ahead with the distribution, people were saying that their daily meals were tea and bread for at least 2 to 3 times per day, and they had lost faith, and it was difficult for us to convince them that we're actually coming. And when we went for the distribution, we could see how desperate people are, and they couldn't believe that actually someone is, an organization is coming and trying to give them some support. The families in West Mosul are living in mostly destroyed houses, or what remains from their houses. The people who are not originally from these neighborhoods are also squatting into houses that are not entirely in a good shape. We have to keep in mind also that West Mosul is heavily destroyed, the infrastructure is heavily destroyed, and there are a lot of remnants of unexploded ordnances from the conflict, and this creates a big challenge for the families to return. This doesn't prevent them though. They prefer being as close as possible to their homes than being in IDP camps or in neighborhoods that are far away from what they have considered their homes for a very long time. And also we have been observing many cases of civilians who decide to return home, and then they face the hazard and the risk of explosives in their houses and around. And we've been receiving many of these civilians to the hospital in Mosul. In Mosul, it's a hospital present in the neighborhood called Wadi Hajar, and our medical surgical team has been treating wounded from similar incidents in the past couple of days. Of course, our presence in West Mosul goes beyond that. We have been working, we have around 30 projects of water and habitat that we've been working on since November in Mosul, but also in areas around it, and these go from rehabilitating compact units, pumping stations, water treatment plants, primary healthcare centers, and hospitals to allow the people to have access to clean water and to healthcare. We have teams also visiting for a while now places of detention, and of course again this is with the perspective of ensuring the detainees have human and dignified living conditions, and we work closely with the authorities to improve and make these conditions as human and dignified as possible.